My name is Regina Williams, and this program is Saturday Online Clinic. It's supported by African Views and supported also by Campaign for Nurse Excellence in Nigeria. It is promoted by Regina Williams Foundation. Okay? All right. We have with us Dr. Segun Victor um, Simon, and I'm really happy to have this doctor with us because he's so well learned and he's vast in knowledge on kidney issues and men's health. So be sure to use this opportunity and send in all your questions. I'll give you a link to his clinic if you want further consultations. Okay, Dr. Simon, you are welcome to Saturday Online Clinic. We are so happy to have you. Can you say hello to our guest, please, and tell us a little bit about yourself?
Hi everyone, thank you Regina for having me once again. You said everything. So men's health is actually something that's important to me because men don't tend to go to the hospital really until something is wrong. And we're kind of trying to change that narrative. And we're encouraging men to visit their doctors every now and then, even if everything seemingly appears to be well.
Yes.
So I practice nephrology. I do some primary care as well, and my practice is located in Union, New Jersey.
Yes. Okay. Thank you. Union, New Jersey. And then you have won several awards as a nephrologist. How do you factor men's health into that? Because nephrology is kidney, right? And then I know nephrologists sometimes do urology, right?
Not quite. So this is how it works.
Okay.
We take care of the kidney in terms of non-surgical care of the kidney. So every disease that involves the kidney that does not require surgery, let's put it that way,
yes,
that will be handled by a nephrologist. Now, the diseases that involve the kidney and the bladder that needs surgical intervention, those are typically handled by urologists. So that's the main difference, really.
Okay, so now we're talking about the kidney, the bladder, and how it connects to the penis and the man's reproductive system. And
correct.
So you are in a perfect position to talk to us about the man's reproductive health.
I believe so. Yes.
Yes. Okay. So let's set the ball rolling. Now, when you talk about men's reproductive health, what are the issues you are? What does it mean? What are the issues we're considering, and what are we looking out for?
Oh well, the reproductive system really does not typically involve the kidney as much. It has to go. It has to do more with the genitals, the scrotal system, and of course the adrenal axis. There's a lot of hormones involved, just like for women, where you talk about the ovaries and some glands even in the brain. The men's reproductive system is also that complex. So what you see physically will be the scrotum, and then the sperm are produced and stored there, and then they come out going through the prostate. There's another organ called the seminal vesicles, and then eventually the urethra, which is the passage that is in the penis, serves really as a conduit for the sperm to pass through and be discharged. Yes.
Yeah. Okay. So when you're counseling somebody, when you're counseling a man on men's health, or when a person comes to you to take care of his, like talking about men's health, what are the things you will discuss with him?
Well, men's health starts with really general health, which is same things that we tell women: eat right, exercise, don't be sedentary, avoid smoking, don't drink excessive alcohol, and all those will apply for men and women as well. But as a man begins to grow older, then there are some needs that becomes very specific to the man. So we start talking about prostate, for instance, because women don't have prostate. So those become specific to men. And we start dealing with maybe erectile dysfunction or other sexual dysfunctions that can affect men separately or specifically. And then infertility is also an issue. I know most people tend to think it's primarily woman's problem, but it is not true. The ratio is really almost about equal between male and female. That's we're talking about infertility. And then as we grow older, we talk about the regular screening that people should have. Check your cholesterol, screen for diabetes, check testosterone level. That will become specific to men, cancer screening and all of that. So it's a whole host of issues that both men and women share. But then, of course, as we grow, like I said, for the men, it becomes specific towards prostate and maybe sexual dysfunction.
Okay, let's go through those problems one after the other. Let's start from infertility.
Yes.
The big thing with infertility would be low sperm count in a man.
Yes, that is one of the causes of infertility. Yes.
Okay, so let's talk about the causes of infertility in men and what could be responsible for them and how men could take care of themselves to prevent, being infertile.
Yeah. Well, on a really broad spectrum, infertility can be categorized broadly into two, maybe primary or secondary. Now, primary meaning a man that's never been able to get a woman pregnant, just to make it plain. And then this could, there's a whole series of things that could cause this, including like congenital diseases, the way meaning inherited defect that the man was born with. So primary issues with sperm production. So that's really not common. It is rare, but it does exist. Now, the other part is the secondary one, in which case maybe there are other factors besides just not being able to produce sperm. So low sperm count will come into play here, sperm quality, and also adequate intercourse, which is actually something that's very common, but people don't appear to pay much attention to that.
Adequate intercourse. Is there inadequate intercourse? What do you mean adequate intercourse?
Yes, there is. I think typically before you can call someone infertile, we say you should at least be able to have a minimum of 3 sexual intercourse in a week for a man, and this should go on for a reasonable amount of time, couple of months, before we say, okay, there is infertility or difficulty achieving pregnancy. So you don't just have sex once and say, okay, well, I'm infertile because the woman did not get pregnant. Okay. So no.
Oh, okay. So that's adequate and inadequate. We're talking about frequency now.
Frequency, correct.
Yes. Okay. So
if you want to go into detail, with each ejaculation, we're talking about sperm count, the total amount of sperm that needs to be deposited at each time.
Yes.
Yeah.
Sperm quality, sperm count. What should be your sperm count to be considered fertile?
I think typically above 20 million, and then with at least 50% of them quality. The quality has some other specificity in terms of the size of the head of the sperm and the length and all of that, and the activity level. We don't need to go into details about those, but in terms of count, go ahead.
We do need. We do need. Okay, so let me ask another question. What can a person do to increase or ensure good quality of his sperm or good quality sperm count? I want you to tell us about foods or how to care for yourself, like, temperature controls and things like that.
Caring for yourself obviously is key, which, exercising again, there's almost no side effects to that, besides soreness and maybe muscle injuries. But it really helps in everything. Eating
exercise will help the quality of your sperm and the count of your sperm?
When you live a good, healthy lifestyle, yes, it works for every part of the body.
Okay.
Then, so people have talked about a lot of food here and there as to what kind of food can maybe increase libido or sexual maybe desire or satisfaction. There's there's not a lot that have a scientific backing.
Okay.
There is a few roots or vegetables. Some of them are called maca, tribulus, or ginkgo biloba. Those are some, or ginseng, some mostly Chinese herbal products that have had some studies behind it, and they've been shown to increase mostly erectile dysfunction, really, and sexual libido, which sometimes it's a little bit different from just infertility. Some people have the sperm and everything, but if you have erectile dysfunction and sort of are not able to, so sexual satisfaction and infertility, I want to sort of separate them. They are a little bit different, but if you have erectile dysfunction, it could contribute to you not being able to achieve pregnancy. Because, for example, if you ejaculate even before penetration, you can understand why you're delivering inadequate amount of sperm to increase your chances of achieving pregnancy. So food-wise, those foods that I mentioned, they have some scientific backing. There are some other ones like nuts, like oysters,
Yes.
chocolate,
Yes.
honey. A lot of these are more of observation from people rather than I don't think they have strong scientific backing.
Okay.
But for alcohol, for instance, if some people they say when they drink a little bit, they get more relaxed and able to enjoy sex more and get in the mood. But excessive drinking, really, especially for men, can have the opposite desire.
Okay, thank you very much for that. So we have talked about low sperm count and quality of sperm, and we
Yes.
have touched on different foods that you could eat to at least help with
Yes.
erectile dysfunction and quality of sperm. Okay, now before we go into erectile dysfunction, let us talk about how a man achieves erection, how his vasculature, the health of his vessels, the health of his heart, his cholesterol level, and all that. How do they contribute to a man being able to have a good erection to help him perform sexually, and keep his fertility up? So,
Yes.
in talking about that, I'm expecting you would touch on diabetes and high blood pressure and the rest of those things. But one second, doctor, do we have a question?
No.
No. Okay. Go ahead, please, doctor.
Yes, absolutely. Achieving erection and maintaining erection are quite complex. Even though a lot of people think it's just as easy as ABC. It takes a combination of the brain and neurotransmitters, the spinal cord, and ultimately your blood vessels are, the conduit. What erection is basically is just blood rushing into the veins and the arteries in the penile shaft to make it rigid. If you have any disease that can compromise your vessels, top of which will be diabetes or high cholesterol, if those vessels are clogged up and they are not able to accept blood rushing into them and staying for a considerable amount of time, then that essentially will be erectile dysfunction. Now, this is just a component of it. This is the physical component.
Yes.
Again, there's a lot of psychological component to this, where the brain plays a lot of part, or the mind, or the psychic, if you want. So, but the physical component, your vessels need to be in shape. Diabetes can, compromise the vascular blood flow to that area. High hypertension, excessive alcohol, like I said, smoking. A lot of smoking can, just the same way this happens to the heart, where you have heart attack, or to the brain, where you have stroke. The same things can happen to the vessels that are supplying your genital area, and that can compromise blood flow there. And if that's the case, it will be difficult to achieve or maintain erection.
All right, so to counter this problem, doctors put men on medication, top of the list being Viagra. And there are other medications that work, on your transmission system, like the messages the brain sends to the body, and others work on relaxing the muscles so that blood can flow. Can you take us through some of the things you recommend as doctors to men who have erectile dysfunctions, and what they should look out for if they're taking these medications? Do I have a question?
Louis Vaddis asks, what's the cause of brain death?
Brain death. Okay, we'll come to that. Okay, go ahead, doctor.
So, erectile dysfunction, as I was saying, has to do with the blood flow. Yes. So, your question was about the medications.
Yes.
That we prescribe for people. First of all, before medications tend to be the last resort. Okay. We don't just go into medication first when people have erectile dysfunction. Okay. We sit them down, we counsel them, we try to find out exactly what the cause is. If it's, like I said, there are organic causes, we want to obviously check their hormone level, chief of which is testosterone. Now, as a young man, teenager, early 20s, you're like a raging bull because your testosterone level is really high and probably peaking at that point. But as soon as you hit your late 30s, maybe 40s, it plateaus for a little while and then it begins to drop gradually. This happens for every man, by the way, so it's not just isolated people. So first, we check the testosterone level to make sure that you actually do have an adequate amount, because that's really what makes a man. A man, all the majority of the characteristics of a man, testosterone is responsible for that. So if that is low, then you may not even need any of those drugs we're talking about. So the first thing to do would be to try to find a way to boost your testosterone count. There are testosterone replacement therapy options available. They have a little bit of side effects here and there, most of which relates to prostate growth and maybe prostate cancer. But we counsel the men, and when we try to replace their testosterone level, we monitor them closely for those side effects. So a lot of people with just replacing their testosterone are able to perform brilliantly and very happy. Now, if they have adequate amount of testosterone, then you look at the other disease condition we've talked about, diabetes, high blood pressure, are they well controlled? Cholesterol, is it well controlled? Is there excessive alcohol? Maybe cut that down. Are they smoking a lot? Cut it out. If you do all of these and then exercise, some people are able to achieve significant improvement. Now, when you've done all that and everything is good, and then you start talking about medications, and majority of them, they are called the phosphodiesterase inhibitors. And what it does is it just allows nitrous oxide to build up in the vessels that supply those areas. So nitrous oxide is a potent, vasodilator. It dilates. Okay, it allows the vessels to relax, so blood can gush into it, and then that way you can have erection. So obviously your doctor has to prescribe this and has to go through your medication list and make sure there are no other medications that can interact with them, because there are potential grave side effects. Like when people take nitrates for the heart, or some other kind of medications that can already cause vasodilatation, we tell them to avoid some of these erectile dysfunction medications.
Yes. Okay.
Can I just touch on something real quick also? the medications are not the buy and all. Besides medication, there are several other options out there. Um, we also have prosthesis now.
We have what?
But prosthesis
Oh, okay, yes.
for men,
Yes.
more like implants. Let me call it implants,
Uh-huh.
where the urology they can actually implant artificial uh, almost like an artificial vessel down your penile shaft,
Mm-hmm.
and then it's controlled by a little motor that's implanted somewhere in between the scrotum, and you can just turn it on and inflate. It will inflate those valves and gives you erection, and you can keep it on for as long as you want. So it can last as long as you want to keep having sex. But then we recommend it to last a time limit, maybe less than at least a couple of hours, so you don't create some injury.
Okay.
But yes.
I saw that with gender reassignment surgeries, um, where the women needed it to, for their new lives. Now we have talked about erectile dysfunction. Another thing I would appreciate if you could touch on is how sexually transmitted diseases would impact on a man's reproductive health. Um, Things like gonorrhea and syphilis and the rest of them, and hepatitis also, hepatitis B, and why it is important that a man really takes care of this and makes sure, um, you know, he is healthy as far as those go.
Yeah, so sexually transmitted diseases, especially in early age, if not well treated, can have potential effect long as in years to come.
Mm-hmm.
Because I think you have a diagram. I'm not able to see it on your where you have a picture of all the whole men reproductive system.
Yes.
Majority of the sexually transmitted disease, okay, will come through the urethra,
Mm-hmm.
and somehow it could get all the way down to the seminal vesicles, the prostate, the epididymis, and all of that. So if the inflammation goes on without treatment, it could eventually lead to scarring if once it heals. That scar formation, the medical word would be fibrosis,
Mm-hmm.
and somehow those could distort some of those anatomy of those tracts in that area, or some cells could even be destroyed for good. And so later in life, sometimes can result in infertility issues.
Yes. Okay. So when a man goes to the doctor, it's prudent to have themselves checked for sexually transmitted diseases, right? Always.
I always recommend that, especially for all my patients who are young, and by young I mean if you're below 40,
Mm-hmm.
45, I will always say, hey, it's good to have this checked. Just so you know, if it's good, then whatever you're doing, you keep doing it, and if it's not so good, okay, it's time to make some early changes to avoid worse damage in years to come.
Okay. At this point, we must stress the importance of using a condom with every sexual encounter, especially if you have multiple partners, to keep yourself healthy. Now,
Absolutely. Yes.
yes. So we will have an in-depth discussion in another program about hepatitis and HIV and how to control this and prevent transmission to your partner. Now let's come back to the male reproductive system, principally the bladder. Now, as men get older, a lot of complaints I have heard from some of my patients say, when I was younger, I could knock over a can when I pee. Now I'm dribbling, so to speak. I'm dribbling urine. I feel like my bladder is not totally empty. I
Yeah.
feel like I have to pee every time I turn around, and
Yes.
they make these complaints. A lot of them make these complaints, and I would like you to talk about the connection of these
Yes.
urinary retention issues with the
Yes.
enlargement of the prostate. I keep saying prostate. It's
The
prostate.
the bladder
Prostate.
and the prostate. Yeah.
Yes.
So this is where really nephrology somehow now connects with the reproductive system.
Mm-hmm.
So we both have two kidneys, and from there's a tube that connects the kidney all the way down to the bladder. That's called the ureter. Now, when the kidney makes the urine, it flows through those tubes, and then it's stored in the bladder. The bladder has a valve at the neck of it, and then the bladder is then connected directly through this valve to the urethra, which is the passage in the penis. And when the bladder is full, it generates a pressure, and this pressure sends signals to the brain that, or the spinal cord, that the bladder is full, and then the signal tells the valve to open up so that urine can flow out.
Yes.
Now, as we get older, as men, the prostate is also at the neck of the bladder, around where this valve is located. And every man's prostate will grow as we get older. That's just how it is, the natural course of the prostate development. So from about age 35, 40 or so, the prostate starts to grow gradually. And sometimes, if you're unlucky, if it grows inward, that is towards the neck of the bladder, it can form like a compression force through this passage. And so instead of you to have, for example, a 4 centimeter passage for urine to flow, if the prostate is compressing against it, it could then decrease it to like 2 centimeter or 1 centimeter. And so now your bladder will need to generate more pressure to force the urine out. As time goes by, this continues, the bladder will start to balloon, let me use that word. It starts to enlarge a bit to overcome this pressure. But once it starts enlarging, it starts losing its power to force the urine out. And this is why most men of advanced age start to see that the stream of their urine becomes weaker and weaker. Before they can hit the wall from a far distance, now they have to go closer and closer, and then eventually they start dribbling on themselves. And then eventually they do not empty their bladder as this prostate begins to grow more and more. So what happens is you lay down, your bladder is full, you get up to go pee, and you only empty maybe 1/3 of it, and you think you're done. You come back, you lay down again, before you know it, you're full, and you have to go again.
That's the frequency, yeah.
That is the increase in frequency. Tends to happen mostly at night, the ones that are prostate related, because when you lay down, you make more urine, and then you notice it more as well.
Okay.
That's nocturia, we call that. And then if it goes unchecked, it gets to a point where some people actually begin to wet themselves because it gets full to the point where they don't have control of it. Urgency, you call that.
Yes.
And then when you start wetting yourself, urge incontinence. And this is where we say, you see the urologist early. They begin to check all of that. The prostate enlargement could be just benign, like the regular enlargement we expect with age, or it could be because of a tumor, which could be a prostate cancer. So both of them are treatable, and those are some of the things we check when men do their routine physical.
Okay. Wow. That was so explanatory as for the frequency and why men feel, that pressure in the bladder. Thank you so very much for that, doctor. All right, so we have talked about infertility, erectile dysfunction, and prostate issues. Do I have any questions from my viewers? Okay. We have also talked about low sperm count. This was very interesting, and I wish that, men, as usual, they are shy. Nobody wants to ask a question, but there will be a link connecting you to the doctor, so you can go ahead and ask the doctor your question, or visit him in his office to check things out if you feel the need for that kind of service. Okay. So at this point, Dr. Simon, what would you say in closing, to put all this together for the men that are watching us, what would you say in closing will be the key things for them to leave this program today with?
I think my biggest advice to men would be, number one, do not be shy, because this problem, whatever it is not peculiar to you. We have this ego thing where when we gather around to talk, everyone, likes to talk big, and I can tell you that almost nobody wants to own up to erectile dysfunction. But we as doctors, we know it exists. We see it every day. I've had cases where wives bring their husband, really force them to come to the office, and sometimes the conversations are very interesting. The men come in, and I'm like, okay, hello, nice to meet you, Mr. So-and-so. So what's going on today? They'll say, I don't know. Ask her. She told me to come here, and this, that. And then, so, as a man, I want men to be more bold and just discuss their problems with their doctors honestly, and because there are remedies for some of these things. And most people, when they do that, they go home happier. And once they get the treatment and they have the issues fixed, it works out well. Don't wait until things are irreparable. Don't wait until you can't get out of bed and move your leg to say, oh, this is when I need a doctor. Every now and then, stop by the doctor's office. Every 1 or 2 years, have a regular routine physical. Check your cholesterol, your diabetes, high blood pressure, sugar, and all of that. And be active, don't smoke, and then limit alcohol to a moderate amount. And but don't be shy. And your problem is not just you. A lot of men have it. They just own up to it. Yeah.
Okay, thank you so very much, Doctor. Now, I did receive a lot of questions from people in Nigeria who are living in the shadows. This is very sad for me. Because they are human beings too, even though they have chosen to live an alternative lifestyle. Their lifestyle in Nigeria is criminalized, so they cannot really come out and speak about the problems they have or get some kind of counseling. So I would directly reach out to you, doctor, and direct their questions to you. I'm talking about the LGBTQ community in Nigeria. And because they do not have a lot of options in terms of healthcare, and they have a ton of questions, especially the gay ones, I would direct them to you, direct their questions, and maybe they can get some help. Because I do not know how to really coordinate the needs of the reproductive health needs of the gay men.
For those people.
Yes.
Yeah, it's unfortunate how the culture and the society down there has reacted to this. I would say it's somewhat expected, but we're hopeful that with this whole integration, with the world becoming more and more of a global village, that with education, with time, eventually people will have access to whatever healthcare need they desire, and that's just the hope. And I think there's some progress being made, albeit very slowly, but hopefully we'll get there at some point.
Yes. Okay. Thank you so very much, Doctor, for your deep knowledge and insight. Do I have a question? No. Okay. So I'd like to thank you and encourage our viewers to not be shy, ask your questions. And for the LGBTQ people, I have received your questions, and I'll reach out to you. And please keep watching Saturday Online program. Next week, we'll be back with either women's health or transplant services. In terms of a kidney transplant, liver transplant, and gender reassignment surgery transplants. I hope to talk with a nurse who will take you through what to expect and how to care for yourself. Okay? So, Dr. Simon, thank you very much. And to our viewers, thank you. I'd like to say good night, God bless, and see you next Saturday on Saturday Online Clinic. Thank you.